to the issue of elective surgeries. 5 weeks ago, Virginia Health Commissioner Dr. Norm Oliver and I signed Public Health Order 2, which temporarily prohibited elective surgeries and limited dental procedures. I sincerely appreciate the cooperation of our healthcare providers and our healthcare facilities. We did this to preserve our PPE for our frontline workers in our hospitals and prepare for a surge if that were to occur. I want everyone to remember where we were 6 to 8 weeks ago. Our case counts and hospitalization rates were rising. We were worried that our hospitals would be overwhelmed by a surge in cases, like we were seeing in Italy and in New York. We were planning at that time how to build alternative care facilities. Around the country, people were worried that we'd run out of PPE and that our nurses would have to resort to wearing trash bags. We found that is totally unacceptable. Because everyone has worked together, we have avoided that. Our efforts to slow the spread of this virus are showing success. Our hospitals have not been overwhelmed. We have been able to get more PPE and developed ways to decontaminate masks and gowns. Hospitals have ramped up testing with a much quicker turnaround time. Early on, remember, test results were taking more than a week, and now in most cases it takes less than a day. Together we took the right actions, and they have been successful. We slowed the spread of this virus. For weeks, our teams have been in contact numerous times a day, working together. Now, hospitals and dental facilities are prepared to restart non-emergency procedures safely. They have worked for weeks to prepare to reopen, and they are ready. And I want to emphasize and underline the word safely. As I said on Monday, our hospitals, our clinics, our dental offices, these are safe, these are clean places to go. And so while we have been through this pandemic, I want to encourage all Virginians that your health care is important, and I encourage you to resume that health care, and we will together do it in a safe manner. So today, I'm announcing that elective surgery and dental procedures can resume when the public order expires at midnight tomorrow night, with guidelines in place to ensure safety for healthcare workers and patients and to maintain an adequate supply of PPE. We know that dental issues can affect the rest of the body, so it's important that dental facilities are included in this. The Virginia Dental Association issued new guidelines to their members yesterday. I'd like to introduce Dr. Elizabeth Reynolds to discuss how dentists are planning to safely move forward. And before she comes to the podium, we have had a great relationship working together to be able to get where we are on Friday. And I would just like to thank Elizabeth and all the dentists across the Commonwealth of Virginia for their cooperation and also for taking such great care of our fellow Virginians. Dr. Reynolds, thank you.
Thank you. Thank you, Governor and Dr. Carey, for your administration's close contact with dentists and other healthcare providers in response to this crisis. I would also like to thank the dentists, the dental hygienists, the dental assistants, and front office teams for their professionalism and dedication to patients as we've continued to see our emergency patients here in the Commonwealth. As you may remember, and as the Governor mentioned earlier, the Virginia Dental Association issued a recommendation to its members on March 15th to postpone elective procedures. Our goals were to preserve the much-needed PPE for our medical colleagues in hospitals and EDs, to keep our dental emergency patients out of the hospital system, and to develop new guidelines to protect our patients and providers in a dental office setting amid this unprecedented and unknown crisis. That said, as the Governor alluded earlier, we all recognize that the longer dental practices remain closed to preventative and non-emergent treatment, the more likely that our patients' untreated dental diseases will progress, increasing the complexity and cost for treatment. As dentists, we have a tremendous ethical responsibility to both our patients and our dental teams. For that reason, we have worked tirelessly over the last month and a half with the governor's office to address issues like access to PPE, liability for healthcare workers. Thank you, Governor, for your executive order signed earlier this week, and on returning to work as quickly and as safely as possible. When the governor's order is lifted at the end of the month, Virginia dentists will be following detailed interim guidelines from the ADA, the VDA, the Virginia Department of Health, and the CDC to keep patients, dentists, and our dental team members safe. The safety of patients, dentists, and dental team members has been and always will be our utmost concern. So as we begin to open our offices for non-emergent treatment, I too encourage Virginians to contact your dental health care provider if you have an oral health need. Some, but not all offices will be resuming regular operations at the start of May, and they can work with you to make sure that your needs are addressed. Also, please know that dental offices have always been leaders in infection control, and our offices now have new protocols in place to minimize the risk of transmission of the coronavirus. Those protocols will include measures like wearing masks to your visits, screening specific for COVID-19, adjusting appointment times and schedules to allow thorough cleaning between appointments, and minimizing or even eliminating patients in the reception area. Also in the coming weeks, most dental practices will be giving priority to those whose dental needs may precipitate urgent or emergent care if not addressed sooner. They will be giving special consideration to patients who are at high risk for COVID-19. They will be minimizing the use of air and water to minimize aerosols, and will be wearing different forms of protective equipment to minimize transmission. Though access to certain PPE continues to be an issue for some practices, we continue to work with our suppliers and with the governor's administration to address these shortages. We are excited and prepared to open our offices and begin safely seeing our patients for comprehensive care. So again, I encourage anyone who may have had to postpone dental treatment or who may be having a dental issue to call your dentist now and work with him or her to develop a treatment plan. I know I speak for all my colleagues when I say we can't wait to get back to seeing our patients. It's what we do, and it's what we love to do. So thank you again, Governor Northam, Secretary Carey, for your continued encouragement and engagement with the healthcare professions. We look forward to working with you and your office to be a part of the solution as we move forward with testing and a vaccine and the ultimate eradication of the coronavirus. Thank you. Thank you.